Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, reporting for the week of November 22nd, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to give you information to keep yourself, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Cases worldwide and in the United States continue to climb. And concerningly, here in the United States, we are still seeing around 1,000 deaths per day from COVID-19. Here in California and in Alameda County, we are still somewhat in this plateau, so we're not continuing to come down, haven't started to tick back up quite yet, but this is something that we are certainly staying alert for, because as we've seen in prior waves, we do tend to follow what's going on in other parts of the world, like Europe, which is now having some very concerning surges in some areas, as well as some of the states here in the United States. So we will continue to keep an eye on that. Last week, the Advisory Committee for Immunization Practices, which is the CDC's advisory committee, proposed and adopted some recommendations for boosters, and these recommendations were essentially made in an effort to simplify the guidance that was getting rather confusing. And so what they did was essentially vote on this table and basically simplified matters so that now anyone 50 and older should get the booster. That is the recommendation. And anyone who is a resident of a long-term care facility and anyone who got Johnson & Johnson 18 and up should receive a booster. And remember, after Johnson & Johnson, it's 2 months. After the mRNA, it is 6 months. And please remember that this is different from the additional dose or the third dose, which is being recommended for people with immune compromise, either immune compromising conditions or medications, in which case they're actually receiving a full dose 1 month after their second dose. So that is a 3-dose series for those with those conditions or medications in order to consider them fully vaccinated. So far, for those who are not immunocompromised, you are still considered fully vaccinated with the 2 doses of the mRNA. That is so far. We don't know if that will change. We don't anticipate that will change, but these are simply guidelines regarding the booster dose. And so now the guideline is that if you are 18 to 49, you may receive a booster. And I think that whether you choose to receive a booster in this 18 to 49 age group and you're 6 months out from the mRNA series really is going to be based on 3 factors. One, how likely are you to catch COVID-19? So that may have to do with your activities or your occupation. Second is, how likely are you to do poorly if you catch COVID-19? So this is if you have any underlying conditions, certainly. And third is, how likely are you to spread it to someone who may do poorly if they catch COVID-19? So this may have to do with who you will be going around unmasked, who you live with, and so on. Now, most of the discussion that the ACIP had was really around this 50 to 64-year-old group, because remember, they were not necessarily in the should category unless they had an underlying condition before. But what the committee sought to do was just to simplify matters. And the reason why with the 50 to 64-year-old age group, they decided to just go ahead with a blanket should recommendation, whether or not there's an underlying condition, is because there was this sense that the list of underlying conditions is so long that the majority of people in the 50 to 64-year-old category are probably in the group with underlying conditions, whether they even know it or not. So remember, in addition to hypertension and diabetes, this group also includes depression. It includes not only current smokers, but former smokers, so ever smokers. It includes obesity. So it includes a number of conditions that people who are 50 to 64-year-old may have, and that the guidance of saying that it should be related to these underlying conditions is just too confusing, and it wasn't worth it. For the small percentage of people who don't have those underlying conditions, they may get a benefit. We don't see much risk, and so that was the decision of the committee. So it was, much of it was based on just simplicity, because what they found is that people were, surprise, surprise, confused, and they didn't know if they were eligible or not. And so this is just to make things more simple. Now, here in Alameda County, we are at 87% of those 12 and up being fully vaccinated. And Oakland is just a few points behind at 84%. So we are really getting pretty high up there. With respect to 5 to 11-year olds, we're already at over 39,000 children 5 to 11 who have received their first dose. And according to the Alameda County Public Health Department's dashboard, this is about 28% of children in that category. So we are off to a strong start in terms of vaccination. And nationwide, you can see here, and this is from the CDC's vaccination tracker, that 3 million, over 3 million children age 5 to 11 have received at least their first dose. Now, you may recall me mentioning this back when the vaccines were first approved for adult use, that Maurice Hilleman, who was really a vaccine pioneer, he developed dozens of vaccines and has saved millions of lives in controlling many common childhood diseases that we don't have to worry about anymore because of his pioneering in the field of vaccine development. He was quoted as saying something like, he doesn't breathe a sigh of relief until the first 3 million doses have been given. And this is really, I think, I don't know how specifically scientific this is, but I like this because this is when you get to see rare adverse reactions that you're not necessarily going to see in a trial. And so I think that it is worth taking note of those who were pioneers and experts even before our time. And we've now exceeded 3 million doses in this age group of 5 to 11. And so, even though I think everything with this pandemic is always evolving and we're always waiting to learn more, I think it is clear that there has not been any safety signal that has identified to date within this age group. And so, we will continue to keep an eye on this. But that fact is certainly reassuring, I think, in and of itself. So, as we are heading into these holidays, and people are going to be mixing more and more, traveling more and more. We're already seeing some very high travel through our airports, and folks are gathering with one another. Yet we know that COVID-19 is not behind us just yet, so we still need to do our part. And so I'm going to dive into some best practices around COVID safer gatherings. Now, of course, we can just say don't gather, stay home, but this is really meant to say that we know that folks are going to be gathering. We know that there are certainly benefits that come from being together. So we just want to do it in the safest way possible. Now, if you are not vaccinated, we do suggest that you avoid travel. And this is really out of concern for you as well as anyone that you may be visiting with that may not be covered. They may be unvaccinated themselves, they may be children, and they may be didn't mount a great response, they're immunocompromised, and so on. And so, in general, if you're not vaccinated, we would still suggest avoiding travel because we still are in the midst of an evolving pandemic, and you are essentially not protected, particularly if you've never had COVID-19, you've never been vaccinated, you don't have any antibodies. We are concerned about you mixing too much. If you must travel, here are a few best practices. One would be to get tested before you travel. You don't want to be getting on a plane positive, and many airlines, of course, require this. Many of them require the PCR test. So if you're going to be getting a PCR, you get the test. You isolate yourself until it is time to travel, because that is the only way to be sure that you didn't then go out and get COVID after your test and before you traveled. So getting tested is a best practice. Also, check the COVID rates wherever it is that you are going, because this can really help you think about what kind of mitigation strategies you may need to do. And this is whether you are vaccinated or not. And most of these recommendations are actually whether you are vaccinated or not. And so, unfortunately, some of the cases with some of the states with some of the higher case rates may also be the states where mask wearing is not normalized. And of course, these things are related. And so, you may just want to be prepared. If you're going into areas in particular with higher case rates, you want to be more vigilant, even if the fact is that you're looking around and people are not necessarily wearing masks and maybe even looking at you strangely because you are. But remember, this is about you doing what you need to do to protect yourself and your loved ones. While you are traveling, we certainly suggest wearing a properly fitting N95 or a KN95 mask. And with the KN95s, we reviewed this before, but you just want to make sure that they are authentic masks. And there are a number of sites that you can go to find verified masks. One of the things that we would recommend in terms of figuring out if it is fitting properly is that you do what is called a user seal check. So this is different than an actual fit test that we might do in a healthcare environment where we're really taking a few more steps to make sure that there's no leakage around the seal of the mask. But there is a way that you can do this on your own and at least get an idea that you have a good seal before you then go expose yourself in terms of maybe within the airports or other places where you have a lot of mixing or a lot of interfacing with the public. OSHA has actually a pretty decent video, and it's in the post for this video. It's just a couple minutes, and you can take a look at how to check if you have a good seal. Now, masks typically will come with their own manufacturer instructions of how to best do this user seal check. But in short, the basic way to do a self check, so on yourself, a user seal check of your mask, there's sort of two basic ways. One is positive pressure, one is negative pressure. And the basic idea is that you are blocking with your hands airflow through the mask itself. And this is, of course, after you put it on properly. You've got the straps around the back of your head, they're not crisscrossing, they are far enough apart. And I like this infographic here from Emory. The link to it is also in the post. But you cover the mask with your hand so that air is not able to pass through the mask. And there are two checks you can do. One is positive pressure, one is negative pressure. Positive pressure means you're testing the seal of your mask by exhaling. And when you have a good fit, you can kind of see a little bulge of the mask. So instead of the air just leaking out through the gaps, it will kind of bulge. And negative pressure would be that you inhale while the mask is fitted. And if you can kind of see it collapse or suck in a little bit, and you're not breathing air from outside, then you should have a sufficiently tight seal of your mask. And again, you can check out the OSHA video to see if to kind of see how this is done specifically. But this is important to do because if you have a big old gap through the or around the mask, then you don't have a good seal, and viral particles, of course, are very tiny and they will go right around it. So it is important that you mold the nose piece around your nose, that you make sure that the mask is cupping your chin appropriately. And you may need to experiment with different sizes, but this test is a good way to see that you have a decent seal. Now, other things you might want to do while you're traveling or while you are in high contact with members of the public, you may want to consider eye protection. And if you wear glasses, that's pretty decent eye protection. Some people are wearing, goggles and shields and all kinds of different things. Essentially, we want to make sure that you have eye protection. It's not known how common it is to spread by the eyes, but we know that any of our surfaces, our mucosal surfaces, are potential. So this may just give you extra reassurance. It also adds another layer of complication because sometimes the glasses fog up and this can be annoying. So test it out before you go anywhere. See if you can get it comfortable where you have a good seal on your mask, you're not fogging up the glasses. That's actually kind of a test in and of itself. And that you feel nice and protected. And in general, especially if you're not vaccinated, we would definitely suggest that you don't eat or drink en route, because even though the airplane has very good air exchange, if you're not vaccinated, again, you're not protected. And if you are sitting nearby to someone who was positive, then you could be exposed. And the best way to avoid that is just to keep your mask on. So, if possible, that is what we would recommend. Eat before, eat afterwards, keep your mask on the entire time, and that is the safest way to go. Now, when you reach your destination and before you gather, especially if you're going to be gathering with anyone who might be vulnerable or who might also be unvaccinated, and this is whether or not you are vaccinated, because remember, even though it's much, much less likely that you will catch COVID-19, and also it's less likely that you will spread it, it's still possible. And so, what we are recommending is that you consider a rapid test sort of up to the minute. You can get peace of mind up to the minute with the rapid antigen testing. I went into a lot of detail on this on October 19th, and I'm still getting a lot of questions about this. And so we know that the rapid test has its use. It is not perfect, but it can be very useful. And in fact, if everyone did a rapid test before they went into a gathering and positives were excluded from this gathering, we would certainly mitigate spread of COVID quite considerably. So this is something to consider. But if you are able to purchase a rapid antigen test, then we would suggest doing so and having that with you. And so when you arrive, you can take this test right before you go into a gathering. And if you're going to be gathering, let's say the next day, then we would suggest that you do that test again. And again, a lot more detail on this in the October 19th People's Health Briefing. Now, if you are gathering indoors, as of course we know many people will be, especially in colder areas, and it is getting colder everywhere. So, if you are gathering indoors, some of the factors to keep in mind to kind of assess how safe or not the situation will be are: how well vaccinated are the attendees? How well ventilated is the space? And is testing being implemented? And so sometimes you may not know all these things, or you may not be able to do anything about these things. But then that was really up to you on how comfortable you feel. And we know that everyone has a different tolerance for risk in these situations. And tolerance for risk should really be based on your own risk, which is going to be very different if you are unvaccinated versus vaccinated, but also your risk of doing poorly if you catch it, and your risk of spreading it to someone who will do poorly if they catch it. So there's all these factors that we need to be keeping in mind. For those of us who are vaccinated, remember that the COVID vaccine is not a silver bullet. We know that it is highly effective in preventing against hospitalization and death. So that is much comfort and relief for those of us who are vaccinated. But like with all vaccines, it does not make you invincible, and it does not eliminate your risk of transmitting SARS-CoV-2 to others. So continue to use caution. And if you are unvaccinated in particular, we recommend that you still wear that high filtration, properly fitted mask indoors. And if you're not vaccinated and there's vulnerable people indoors, maybe you wear that mask indoors, and maybe there is the opportunity to eat outdoors or even near a opened window. These are all things to consider. And remember, we are going to be getting tested before we go around vulnerable people unmasked, because at the very least, that rapid test is going to be positive when you are very contagious. It's not perfect, but it is a helpful indicator. Regarding ventilation, not always easy to assess. And again, everyone's going to have a different comfort level on how much they want to assess this. I don't mind popping up my little CO2 monitor wherever I might happen to be just to get an idea. And it could be very illuminating, really, to see where you are in terms of CO2 accumulation, which only happens if you are in a poorly ventilated space. And so you really want to be sort of in that 750 range. Once you start getting over 1,000 parts per million of carbon dioxide, then you know that the space is not great in terms of its ventilation. And it is amazing how even just cracking open a window or a door can actually make a huge difference. And of course, the more people within the space and the more that the air is basically filling up, not only filling up with CO2, if someone is positive, is filling up with SARS-CoV-2 as well. And so that is something to also consider doing. But really, you can also just look around. Do you see open doors or windows? Is there any air movement that you can feel? Maybe there's central air. That's great. In some parts of the country, central air is the norm, not everywhere. And I'm sure it's very difficult for us to be able to notice if there is a proper filter on someone's HVAC system. And so, to some extent, there is just, we're not going to always know all these things. But also, how crowded is it? So, when you're assessing the crowding within a space, it's not really just about distancing, because really, I mean, if we're really thinking about it, if you're spending hours on end indoors and a place is poorly ventilated and it's crowded, then if just one of those people is positive, then we know that it is possible that they can spread it to particularly the people that are nearest to them. But really, if you're spending long enough in that space, and if it's not well ventilated, then it can be spread to everyone in that space. And we know that there are many events that we've heard about where this happens. And of course, this can happen whether or not you are vaccinated. Now, if you're vaccinated, you're much less likely to then die from catching it or become severely ill. But nonetheless, then you can go ahead and pass it on to someone else. And of course, if people are eating or drinking, which typically holiday gatherings involve eating or drinking, and everyone's masks come off, then this becomes an even more kind of critical piece. How crowded is it and how well ventilated is it? Now, the other thing to consider is to keep a guest list, or have the host to keep a guest list with updated phone numbers, because in case anyone does develop symptoms or test positive, we want to be able to contact everyone so that they can isolate themselves and get tested, and we can avoid spread of SARS-CoV-2. Now, if you are outdoors, we know that you are much safer, and we know that many people are planning outdoor events. You can have your tents and your outdoor heaters, your fire pits, what have you. You may be wanting to set something up where it's indoor outdoor. Perhaps when you're inside, you're wearing the masks. When you come outside is where you're eating and able to take off the mask. And even though we know that transmission can occur outdoors, it really is much, much, much less likely. So if this is something within the realm of possibility for you, and we're seeing that a lot of people are getting very creative with this, then we definitely suggest that you consider this. And again, some of the same factors will be something to consider, like how crowded is it, and are they vaccinated? How far apart are you? And what activities are you doing? You know that if we know that if people are singing and yelling, that does generate more droplets, and those can travel far, even outside. And so if you can't adequately distance, and you feel that it is crowded, and you don't know people's vaccination status and so on, then you may still want to wear a mask. But in that case, it doesn't have to be the high filtration masks. You can just wear anything that's going to cover you from the droplet transmission if someone is just too close to you, and let's say yelling or screaming, like let's say maybe at a game. And so these are all kind of things to consider if you're outside, but in general, you are going to be much safer outdoors. And even if someone is positive, their SARS-CoV-2 particles are much more likely to disperse before they can infect you. And even if they did reach you, the dosage or the amount is likely going to be much smaller, which we do believe is correlated to less severe disease or less likelihood of even becoming symptomatic. And very rarely we know that COVID infections can occur from contaminated surfaces. We know that this is the least likely way, but it's still a way. So just be sure you're not sharing utensils or drinks or smokes. And in general, you'll want to sanitize high touch surfaces. We don't want all to be grabbing the same utensils. So kind of an argument against buffet style. And of course, you're going to want to wash your hands often and certainly before you touch your face or you eat. And if you don't have access to a sink, you're going to want to sanitize your hands. So remember to bring the sanitizer and the wipes along wherever you go. To optimize your immune functioning, take a multivitamin supplement, consider additional vitamin D supplementation, manage your stress, and get a good night's sleep. Now, whether you choose to stay in your bubble or to venture out, we hope you have a safe and happy holiday, and we will see you here next Tuesday at 10 a.m. Thanks for joining.